Yeah, nowadays what we can say is that cryoablation may replace the surgical resection in those patients at the very early stage. It means patient with T1A tumor with favorable biology. That means HR positive, HER2 negative, up to 50 millimeters. And in that setting, the cryoablation has to be considered a definitive treatment, in the same way as the surgical resections.
So far, we have two major phase 2 studies, the ICE3 and the FROST studies, published very recently. And these two phase 2 studies showed that the cancer-specific survival at 5 years is very good, around 97%. And in these two series, the ipsilateral breast tumor recurrence rate is very low as 3 to 4%.
In the metastatic disease, cryoablation could be also an option when the patient is under systemic treatment with a very good response, but one or two sites escape to the systemic treatment. And in this case, it's very interesting to propose a biopsy to understand why the tumor is evolving in this site and to treat in the same time. And the percutaneous treatment like cryo could be very beneficial for the patient.
The combination of breast cryoablation and immunotherapy is a very exciting area, but still exploratory. We know that breast cryo could have immunomodulatory effects because tumor freezing preserve the antigen material and could promote antigen release and dendritic activation and T-cell priming. It still needs clinical validation.
I'm very excited that ECIO has decided to introduce cryoablation as a main focus in part of their conference. A lot of people are becoming very interested in cryoablation of the breast, but it's important to note that this is not a treatment that is just putting a needle in and treating the cancer and then you say goodbye to the patient. It's actually something that you become, as the interventionalist, you become that person's doctor. So these patients that I do cryoablation with, I have to understand who's appropriate, what does the imaging look like that is favorable, how to treat the patient, and then how to follow the patient. These patients, once I do this procedure, they're my patients. I don't send them back to the surgeon, I follow the patients. So it's not something that is just an easy procedure to just learn. It goes way beyond the procedure.
To be in this field, we have to remember that stage 1 disease of breast cancer represents more than half of all patients right now screened and diagnosed with a breast cancer. So we need to be here and to be completely involved in this growing field.
At IceCure, we are proud to lead the way in early-stage breast cancer cryoablation treatment. After completing the ICE3 trial, we have shown that IceCure technology is safe and effective for the treatment of early-stage, low-risk breast cancer patients. This got us to get an FDA approval. We are the first and only company in the world to receive FDA authorization to use cryoablation to treat breast cancer patients. That led us to the recent recommendation by the American Society of Breast Surgeons to include IceCure technology as a safe and effective one to treat a specific group of early-stage, low-risk breast cancer patients. We are proud to offer a treatment that is personal, allow the patient to keep the whole shape of the body without tissue removal, without pain, without scar, allowing them to come in and out of the treatment room within 1 hour and resume full activity almost immediately.
So at Boston Scientific, what really makes me excited and proud is offering minimal invasive technologies. With cryoablation, we create awareness through education programs. And moving forward, what we are committed to is gather more evidence, helping physicians, but also patients to understand which patient can benefit the most of minimal invasive technologies, not only to improve outcomes, but also their quality of lives.